Good, drop the head. Nice. And all the way out. Good. Good. There we go. Back out like the other birds. Good. Land your back for me. Alright. You completed your first adjustment.
Wow.
I'm gonna get that.
That was crazy. I was nervous.
Yeah?
Yeah.
You were nervous. How do you feel?
I feel good.
Good. Now we're going
Yeah.
to show her how to use this specific device. Now there's a lot of different devices. This one I just like personally because it's easy, it's very light, and it's easy for the patient to use at home. It's not complicated. So we are reviewing a patient's x-rays, and we want to show you how to actually utilize those devices we talked about earlier. We adjusted the patient. Now it's time to set them up on some traction that they're actually going to use at home. And what we're going to show you here is this on this x-ray is that the green line is where the curve needs to be. So how do we get this negative curve, which is actually a kyphosis? It's going the wrong direction. We got to do traction right here to bend it back into place. So if you guys follow me, we already got the patient adjusted. We're going to set her up on traction. She's going to use at home. This is Sydney. So we already adjusted her. Now we're going to show her how to use this specific device. Now there's a lot of different devices. This one I just like personally because it's easy, it's very light, and it's easy for the patient to use at home. It's not complicated. You've probably seen in some of our other videos where we have a ServaGuard. It looks like braces for the neck. It literally works like that. So I'm gonna have you lie back this way. Good, good, and then I'll have you lay back first. Perfect. And then you stay completely relaxed. I always have the patient stay completely relaxed. Lift your head up just a little bit and then relax your head back down. Good. And then I do this because I want them to feel exactly how it feels when they lay on it. So I'm going to hold this in place. I'm going to let her head drop back. Perfect. And there's a bunch of different settings to these for this. Don't worry about the settings because I'm going to teach you the settings once we have your x-rays. And I also did not set this up yet for her x-ray, but this is just for demonstration purposes. Now we're going to put this band on the top of the head, and we want to pull pressure. And so Sydney, you want to feel a decent amount of pressure, but not so much that your head's going to rip off. Okay. Do you feel pressure at all yet?
Yeah.
Okay. You think that's good, or we should pull more?
No, you can do more.
Okay. So we're going to pull a little more pressure this way. Actually, we're going to start with this one. Then we're going to come to this one. Okay. That too much?
I think that's good.
Think that's good there? Okay. So now, when you do this at home, you want to start with the same amount of pressure. Okay. So now, she's going to lay here. We want to work up to 20 minutes. Start with a few minutes at a time, work up to 20. What's going to happen, though, when she's in the clinic is that after maybe 4 or 5 minutes, you're going to feel a lot more relaxed. And your head's literally going to bend further. So what we want to do is want to take advantage of that. It's called ligamentous creep. I hate that word, but it's called ligamentous creep. And then you just pull this a lot tighter, and then her head's going to bend back even further. That's the physiological principle that we want to capture, we want to take advantage of, because that's how you get curve correction. Now, over the course of a couple months, then we re-x-ray, you're going to see that curve starts to change. She's already going to feel a ton better. She's going to feel a lot of symptomatic relief over the next couple months as well. Migraines go away, headaches go away. It just depends on how bad that individual person is, for how long it's going to take for them to feel the symptomatic relief. Okay? Any questions, comments, complaints?
No.
All right. We'll see you guys next time. Left ankles, and then you can show on the camera, the left ankle is slightly shorter. So that's not a centimeter, but it's about half. And if you look at the shoes, they're also shorter. Then I lift up, and actually if you come down here and you look up her spine, you can see that this left shoulder is much higher. Right, so now let me know if there's any pain or discomfort in your low back.
Okay.
Pretty good flexibility. Good. Any pain with that?
Nope.
And I'm also looking, so first check was pain. Now I'm looking at her hips to see what happens when I lift the leg up. Not a whole lot of movement, but a little bit more than I want to see. So now tell me if there's any pain or discomfort when I push into the hips. Yeah, right there. The right side feels a little bit worse than the left. And now this is the actual hip joint. They feel close to the same, but you're right, I feel a little bit more. When I push there, your whole hip moves with me. You feel that? You're right there too.
Yeah, that's like
Tender?
Yeah.
Yeah. And so this is right what I was talking about, stomach, so digestion. Acid reflux, heartburn. Yeah, right here too. Now you don't have any history of car crashes, do you?
No.
Okay. Yeah, right here. Right here too. When I push here, does this travel to your eyes or your head at all?
No.
No? Okay. Good. How about when I push on this side? Was that one more tender?
Yeah.
Could you feel the difference?
Yes.
Yeah, that was, so the left side was really stuck out pretty far. Okay, so we're gonna do the adjustment. I'm gonna do a little bit of the instrument work first. Your flexibility is pretty good, so we don't really need to work on that. So what we're trying to do here is to get each individual part of your low back to move. Not too much pressure, is it? Okay, good. Because what we want to do is we want to start to get nice healthy curves back in the spine. Good. You can take a deep breath in. All the way out. Good. There you go. That moves pretty well. Good. Good. Take another deep breath in. All the way out. Good. Deep breath in. All the way out. Good. Deep breath in. And all the way out. Good. There we go. Good.
Wow, that's crazy.
Yeah. And you'll see how much better you feel too afterwards. Good. Good. Relax this short shoulder. Perfect. Good. Good. Yeah. Relax the shoulder. Good. I went very light on that one. There you go. Excellent. All right. Good. Now I'm going to have you lay on your side facing me.
Okay.
We're going to adjust the hip that was worse. Good. So you can relax your head on there. Slide your
Should I
hip.
put it back in here? Or no?
No. I'm going to have you slide towards me. Good. Keep going. Good. Bend this knee. Good. Okay. Perfect. Good. Arm goes back, kind of like a yoga pose. Good. Okay. Lay on your back for me. Good. How does that feel?
Good.
Good. Good. Let your head drop. Good. How often do you get headaches?
I would say like every day.
Every day. Oh no.
But I think I just hold a lot of tension in that area.
Yeah. I'll tell you, a lot of that's coming from the neck curve, or lack thereof. Yeah, so once we get your x-rays, I'll go into I'll get some devices you can use to help fix it. drop the head. Nice. Good. So take a breath. Okay. Good. And now, relax the head. Now take a breath. Did you notice more air the second time? So all I did was change the shape and curve of your neck. Good. You're gonna feel my hand under your jaw. Bring your teeth together, but don't clench. There you go, perfect. You're gonna feel me lean back a little bit. You'll feel a little pull. Nice. Good, how'd that feel?
Good.
Good. All right. You completed your first adjustment.
Wow.
I'm good with that.
That was crazy. I was nervous.
Yeah?
Yeah.
You were nervous. How do you feel?
I feel good.
Good.
Yeah. I feel like a lot of it too is like I just need to start stretching better and just I feel like a lot of it is me as well.
Yeah. I mean, you're already working out. So I'll give you the 411 or the whatever 101. You're doing a good job staying fit, but the only missing component is you can't really self-adjust. People try to, but what happens is you're not moving the joints that need to move. You're moving the ones that are already moving too much.
Right.
And I just had a patient like that yesterday. That was one of the reasons they were coming in was because they just self-manipulated all the time, and they did it so bad that now he's got tingling in both of his arms. He's like, I'm not supposed to do that, right? I'm like, oh, of course you're not supposed to self-adjust.
Right.
But your joints, while obviously you're young, that's a good sign. They still moved well.
Yeah.
But you've got to keep them moving well, right? So it's no different, and it's more important than, arguably more, it's not more important than movement, but it's part of movement. Does that make sense?
Yes.
So just being consistent with it. And you'll start to see the compound effects of just getting adjusted consistently.
Yeah.
Especially with what you're doing now.
Yeah.
Because you got to be able to study for long hours, plus you got to keep your exercise routine up. Otherwise you're going to crush yourself with school.
I know. Yeah, you're right.
Even if it's just a quick run in the morning. Yeah.
It's actually okay right now. It goes through phases.
Okay.
Sometimes it gets really bad where it's like complete lockjaw. Is that like just like genetic, or is that like stress, or?
So a couple different things. So I didn't evaluate your jaw. We'll start with the adjustments, and then I'll evaluate the jaw. The number one cause, or the most common cause of TMJ issues, is loss of cervical curve.
Really?
Yeah. So think about it. If you have a normal biomechanics in your neck and all of the joints in your head and then muscles attached to things around the neck and the spine, and you start to change that curve, you're getting a lot of muscle tension with the head coming out really far forward. It's literally pulling and contracting on the neck, the face, and then the back of the skull, right? And then the nerves that come out of your brain stem also control these muscles and all those actions of the jaw there.
Okay.
Short of a direct trauma to the jaw itself, most common causes are the loss of that curve.
Okay. I didn't know that.
Yeah. So the headaches, the neck issues, the jaw issues, they're all coming from one source.
One thing.
Yeah.
Okay. So like.
Because nobody should have headaches.
Right.
Or definitely not migraines, but definitely not headaches either.
In like an unbiased way. Like for my age, do you think that like I'm okay, or do you think it's like?
Yeah, I think you're in a place where you can absolutely fix things.
Okay.
With minimal effort.
Okay. Because I feel like that's like my main concern. Because I do work out a lot.
Yeah.
And I don't want what I'm doing when I'm working out to be conflicting with this stuff. Because I feel like maybe in the beginning it did, or like even like when you're first starting to work out, like whatever it was 2-3 years ago, you first starting to lift heavier weights, your form's a little off, you're putting a little more strain on your back, whatever it was. Now I feel like I'm fine, but I feel like even like with like the upper part, sometimes I just get so frustrated because I'm like, I don't even know how to fix that, or I don't even know how I did that to myself, because I feel like I did it to myself. So I did something, but it's just
and just to give you an idea, I also still, I don't want to call it injure myself, because that's a normal part of training.
Right.
You saw your posture, right? So if you just put a weight directly on top of you, hips are going to continue to come more forward and your head's going to continue to do that. So if you do that right now, do that. Tell me you don't feel more pressure. Well, you're leaning forward a little bit, but you'll feel more pressure here because you're bending here and you're bending here. You're going to feel, it's just like a straw that you just bend. You're going to feel it, right? So that's where you're feeling it.
Yes.
You know, I pull my hips back when I lift heavy, but even when I do that, all the weight is coming right down here. It's gonna hurt after I work out, especially if I'm trying to lift really heavy. There's no way around that.
You advise it still if you think it's still okay to do, or should I do
Absolutely.
it like modified?
No, you should be doing it.
Okay.
Because there's nothing we can't unfix as long as you're consistently taking care of it, which all that means is getting adjusted.
Right. Okay.
Right? There's almost arguably nothing you can't, I don't want to curse, but unfix.
Okay.
If you fix it up.
It's good. That's good to know.
Yeah. No, keep working out. I would almost never tell somebody to stop working out.
yeah, of course not.
Yeah. Any other questions?
I think that's it.
Okay. After the first adjustment, you should feel a lot better, move a lot better. You should have more energy, and you should sleep better than you've ever slept before.
Okay.
Yeah, for sure. Rarely are people sore. Maybe 1 in 20, 1 in 30 people are sore, but that's because they don't hydrate.
Okay.
So you have Element. There's some back there. Make sure you drink some today.
Okay. Yes, I will. Awesome.
Case closed.